A World Bank assessment deems Indonesia a country with inadequate pension and whose elderly population lives below the poverty line. Indonesia's pension system is in urgent need of reform, with health care services for pensioners below minimum standards.
Indonesia must devise an economic strategy to address its aging population, which threatens to become a demographic burden. Key areas in urgent need of reform include the pension system and healthcare for pensioners. World Bank economist Philip O'Keefe says the Asian Pacific countries continue to struggle in providing adequate public services for the elderly. Poor planning and management of pension funds has been cited as the main factor in the rising population of elderly living in poverty. An aging population has serious economic ramifications, with growing pension payments and health subsidies placing a strain on the rest of the population. But this can be mitigated through improved management of the pension system. Philip says various East Asian and Pacific nations, including Japan, Korea, and Singapore, have public programs in place for pensioners.
It is a big challenge because most countries, once they have a large elderly population in history, have also had a strong pension system, for example, which Indonesia is still developing that, China and other countries are still developing that. So it is a risk that people will have more poverty in old age, and you see that in the numbers in Indonesia. Those over 70 years old are much more likely to be poor. That's one factor. Also, they will...
Director General for Social Security and Welfare, Harry Hikmat, says most of Indonesia's elderly live in poverty and are neglected by both the state and their families. The Social Affairs Ministry is providing social aid, including financial assistance, through its Family of Hope program.
Nah, mulai tahun 2016 inilah manfaat PKH juga mulai didorong untuk mencakup penyandang disabilitas berat dan lanjut usia, terutama dengan kategori tertentu, yaitu berada dalam situasi miskin dan di atas 70 tahun ke atas, dalam rangka mempertahankan taraf kesejahteraan sosialnya.
Indonesia's elderly population in 2016 stands at 18.8 million and is predicted to rise to 46.2 million by 2035 and over 80 million by 2050.